Namaskar. Welcome to PGurus Prime Time. I'm your host Sree Iyer. Today I have with me returning guest Shantanu Gupta ji, the author of the book The Monk Who Became Chief Minister. Shantanu Gupta ji, Namaskar and welcome to PGurus channel.
Namaskar, Sree.
And I also have as co-host Sridhar Chityala ji. I also have as co-host Sridhar Chityala ji, whom you all know as a co-anchor of Daily Global Insights. Sridhar ji, Namaskar and welcome to PGurus channel.
Namaskar and looking forward to the program.
So, viewers, we have a very engaging session in front of you today, and we're going to talk to Shantanu ji about the spectacular way in which Uttar Pradesh has handled the COVID outbreak, the second wave, and also we need to contrast how the Chief Minister of Uttar Pradesh, Sri Yogi Adityanath ji, had come right out of being COVID positive and hit the ground running, whereas a couple of his opponents, or what you could call as tentative contenders for the chief ministership of UP in the future, have been sitting in the comforts of their home and tweeting away. So if you look at what exactly is playing down out on the ground, what are the challenges that Yogi ji has been facing. I'm going to let Shantanu ji first come out with an introductory couple of minutes of what he thinks is happening on the ground, and then I'll start framing some questions. Sridhar ji also has a couple of questions for you, Shantanu ji. So here we go. Shantanu ji, over to you.
Okay, so Namaskar, Sree ji, and all to the viewers of PGurus. So yeah, it's tough time all over India in second wave, which started somewhere in 15th, 16th of April. I think till then everything was like almost fine. The things were opening up, and if you go to any market, like it was not almost normal, but yeah, normal with masks, right? And in the first wave, India in general and UP in particular handled it beautifully well. So much so that it got a loud shout from WHO, a lot of other organizations. And what did UP did good in the last wave is setting up early containment zones when people didn't even know about what containment zones, micro containment zones, testing facility. The first sample was from UP went to Pune. We did not have a facility to test. Then he said like every district and almost 300 testing centers, PPE kit, gloves, masks, all this medical equipment. They were available, but not in like so much excess that everyone needs a PPE kit, right? And then all the labor was thrown out from Maharashtra and Delhi. They were not very responsive with their labor, right? Which were fueling their economy. And through train from Maharashtra and through buses from Delhi, he made sure that all of them come back. And while coming back, they have set a containment zone outside the village. They set up something so that they will only go back in the main life of village once they spend some quarantine or all of the testing is done. Even so much so, there is a very famous city called Kota in Rajasthan, which is big hub for IIT training, IIT coaching, IIT coaching, right? There, a lot of UP students were there. Like, this is a very private affair, right? And upper middle class people. But again, they're stranded because there were so many lockdowns. He made sure buses go there also and take those students back. So that was wave one, and it was very well handled, right? Now comes wave two, right? In the mid of April, right? By the time the vaccination was also started. And what we heard about United States of America in the last wave, what we heard about UK, what we heard about Italy or Spain, that oxygen ran out in hospitals, beds ran out in hospitals, old people in Spain, it seems, asked to wait at home, almost die at home when they're taking care of their young. All of that, the traces of that started coming in India, right? A lot of people say, I said so, but there's no credible report till now which said the amplitude of the second wave will be this much, right? Similar case happened in UP. They had, and I think the pressure was largely on 2-3 resources. So it's still the people who are home quarantined, right? So there are two kinds of patients, right? So when someone get COVID positive, if the symptoms are normal, they're advised to be home quarantined, right? And a free kit from the government goes to a home, right? With an oximeter so that they can keep checking their oxygen also. And with a basic set of medicines based on their symptoms, and multiple calls go to them twice a day from the command call center. That was happening in UP and still happening and very appreciated by the people. But a small number of people, like 7%, 10%, who landed in the hospital, that became a huge burden on the medical facility, because a lot of them all of a sudden started requiring oxygen, started requiring steroids, something like a medicine called remdesivir, right? Then it became tricky because government has planned for 2x, 3x, but government has not planned for 20x, right? Which was not even predicted by anyone, right? And unfortunately, and that was UP's bad luck, Yogi Adityanath himself got COVID positive during exactly the same time, right? And he has a team 11, now it's called team 9, 7 officers from there, another 8 very senior officers, they all got COVID positive, right? And some with decently severe symptoms, right? Though the state machinery did not stop, right? They were all talking to Zoom. Yogi Adityanath was also talking to Zoom. But again, see, Indian bureaucracy still work on, like, if I can use little danda, right? The leader has to be there, right? Leader has to be there. There are processes, but again, processes work with certain efficiency with the leader as a magnet there. And when the magnet goes away, the efficiency also goes down, right? So I think that was there. That was there. So we lost them 3-4 days. But again, as soon as Yogi Adityanath was back, the day he was just tested negative, right? You know, right? There is a whole literature about
Yes, yes,
post-COVID
yes.
how you recover. There's a huge literature around that, right? You eat this, you eat a lot of fluids, how you sleep, how you take rest, all of that. He did not follow all of that, taking a personal toll. He just started traveling, right? Not traveling to Lucknow, where he resides, the capital, districts after district, villages after villages, right? So, and if you just see the numbers, the long story short, on 30th of April, when the panic button was full on, we have 3 lakh active cases, 300,000 active cases in UP alone, right? Today, I was just listening to the press conference of the information department, that caseload is 1,36,000, right? Almost 56% caseload was reduced. That day, 36 daily cases were coming. Today, the report is, let me check the latest data, only 8,000 new cases are there. And 21,000 people are getting discharged. So the number of people getting discharged is become far, far more higher than number of people who are getting new cases. So the caseload is not increasing. The active cases are not increasing. Active cases from 300,000 have reduced to 1.36 lakhs, right? So that's a major reduction. A lot of things have happened, and I will tell you in response to your questions also.
Yes.
But that's the larger picture that we are standing today.
So thank you so much for the introductory, data on Uttar Pradesh. And viewers, I want you to kind of take a quick look at how the ASEAN nations are faring in terms of what kind of vaccine coverage they have, how much vaccination has happened. I had planned to give you an image, but unfortunately in the setup I missed it. But Sridhar ji is here, our data man. He's going to walk us through country after country after country after country, how they are all faring now, because everywhere the second wave is beginning to raise its ugly head. Over to you, Sridhar ji. A couple of minutes quickly, comparison with UP of all these countries like South Korea, Singapore, South Korea, Singapore, and Malaysia, and all those countries around there, Thailand, so on and so forth.
Great. Thank you so much. And let me, there is a much touted coverage around the availability of vaccines and the dispensation of the vaccination to the wide universe. But people forget in the world that one of the biggest challenges the world has faced, which not only WHO, but the general reporting is that there's a significant vaccine shortage around the world. Now, all you need to do is look at ASEAN. ASEAN is, home to large segments of population, and they are in the middle of the second wave. Remember, at least 3 countries were touted as very efficient in terms of the management of the first wave. Taiwan. Now, Taiwan is now seeing rising cases. Japan has not recovered at all from the first, and it's still rising in the second wave. Then you have the little countries like Thailand, Vietnam, Philippines. All these countries are demonstrating that there is a rise in cases. Singapore is now in its second lockdown. So let me give you the quick numbers. Indonesia has got, there's a total number of 1.7 million cases. only 3.3% of the population vaccinated. Philippines has got 1.15 million people and only 0.6% of the people vaccinated. Vietnam has got, cases. These are not population. So Indonesia has got 1.74 million cases. Philippines has got 1.15 million cases. Vietnam has got 4,359 cases, 0% vaccinated. Thailand has got 111,000 cases, only 1.1% of the cases. So when you run down the list, barring Cambodia and Singapore, Cambodia at 7.4% and Singapore at 23.2%, most of the South ASEAN nations remain very, very low in terms of the penetration of the vaccines. So they are highly susceptible to what is likely to come should there be a third wave, which looks almost imminent because the WHO is stating that this is by no means over and it is coming. I have not stated the Japan numbers. Japan has got 126 million people and relatively small number of people have been vaccinated.
Thank you very much for that update, Sridhar ji. I just wanted to place in front of you, dear viewer, that whatever India has faced over the last 3 or 4 weeks, every country in the ASEAN region, perhaps all the way up to Japan, is going to face this. Why? Because unlike other viruses before, this is an airborne virus. Second thing, I've already said this in other hangouts, the average size of a virus is around 20 microns. This one, COVID, is 20 times that size, 10 times to 20 times that size. Look, a big, big, big ball. And also the virus is morphing. You talk about double mutating versus the original version that was the first wave. In the first wave, you had this protein thing sticking out, if you remember the original picture, and those look like nails sticking out of the basic ball. Now what has happened is, when you are looking at the pictures of those who are having the double mutant, the stick is still there, but instead of a nail, now it has got a small mushroom-like cloud. So how the heck did it change signature? This is for someone to look at. I'm sure Indian government is looking at this. Essentially, what I'm trying to tell here is this is not a naturally occurring virus. It is something beyond that. So we have to be on our guard. And good news is Covaxin appears to have been the most robust vaccine that is handling both the first as well as the second wave, at least as far as India is concerned. And I can go on, but I will just jump into some questions that I have for you, Shantanu ji. So Sridhar ji, you and I can alternate questions. Since
Sure.
You are the co-host, I'll let you start with the first question yourself, sir. Then I'll ask my first question.
So thank you, sir. What is the now Yogi ji case study has been written by Harvard. There's an article that got published, I think, The Guardian, which outlines how Yogi ji has dealt with not only the first wave, but also moving into the second wave. I think you gave some numbers, if I'm correct, that by the numbers that I've seen, it's about 1.63 million people got affected, total number of cases in a population of about 230 million people, of which you have a more latest data, which says the active cases is about 136,000, and then close to about 18,000 deaths. So relatively on the top 5 scale, you find UP, given the population, the numbers seems to, at least on the initial response and management, seems to be well orchestrated. So what has made UP to be successful in terms of managing this?
I think 2-3 things. As I already alluded, they have something called a Team 11. It changed to Team 9. And what is this Team 11? It has politicians and bureaucrats from almost all the stakeholding departments, like medical for sure, even police, because even home department, food supplies, even business, so that business should not stop, right? So they are giving supplies, coordination with other states. And Yogi made sure in last 1 year, he's talking to them every single day, right? Even in the morning or before going to the bed, right? So that's why nothing is going out of control all of a sudden, that you don't even know that's happening, right? That's one. I think the major problem that happened in oxygen this time, which was a major problem on 30th of April, which we don't have today, right? We were only getting some 300 metric ton of oxygen. It's almost tripled in last 13, 14 years. What did they do for that? They have put a separate control room just for that, right? And you must have heard Delhi Chief Minister Arvind Kejriwal saying, I don't know what to do, where to get. It's a centralized commodity. I don't have cryogenic tanks to ferry them. I think, literally, if I can use the word, he was just faking it, right? There are a lot of, even personally, people can buy oxygen, right? Like, how can a chief minister cannot buy oxygen, right? So what UP only had 30 such tankers. They have repurposed, bought, and today they have 90 such tankers, right? And they're using all the three means. They're using road, and they're sending till Jharkhand, where the road thing is happening. They are the first one to use the railway. You must have heard the Oxygen Express term, right?
Sure.
Railway was ferrying from, because a lot of these heavy steel plants are in Odisha,
Yep.
right? And where oxygen is a byproduct or a product to be used, right? So there they started, and Naveen Patnaik, who are from a different party, right? He's supporting the whole nation like full-heartedly without even taking a credit, right? That, okay, I'm doing it, right? UP government was the first one to liaison with them and make sure that the large part of this Oxygen Express come to them. Now also using the Air Force, where I'm sitting currently in Noida, next to me, the town called Ghaziabad. There they made sure through Ranchi and Jharkhand, all the ferry can go quickly and the oxygen can come. And all these tankers and all this movement was tracked by GPS. They quickly developed a software in 2 days, put GPS on all of them, and they've shown it in the press conference how every truck was moving. Even during that press conference, they were saying this may take 5 hours. So they also have the anticipation that how much oxygen I'm getting in next 1 hour, and where it will go, how it will go to the district, and then to the hospital, that's to the refillers also, for the cylinder refillers, right? That's being one. Second worry was that it was also spreading in rural, right? Why rural is a bigger worry? Because the health infrastructure in rural is not as good as districts, right? So what they have done in rural is really, really massive. And if people will realize this, the people who have done something in life on a scale, they will appreciate it. So UP has how many villages? 97,000 villages, right?
Wow.
97,000 entities. Like, when I say entity, means like a separate name, a separate pradhan, a separate head, right? With a population of 23 crores, right? That many number of villages. So what they did, they made a team of 1.41 lakh people, right? One of you may keep translating into the American format, because I'm not very quick at it.
That's fine. Yeah.
Right. So 1.41 lakh teams were formed, right? And these teams were sent to each and every village with an oximeter, with a whole SOP. And they asked symptoms, right? Whenever they found any symptom, they did a antigen quick test, right? And if the person was found positive, there was quarantine places made in every village, in the school building or in the Panchayat building or in the Asha Anganwadi building, right? They were quarantined. And if they are not positive, then a small briefing was there that, okay, this is the way you can get vaccinated. The vaccination is coming to your village. And if you get, and what is the COVID appropriate behavior? So this also gave, first of all, they have already touched almost 93% of the population in the last 8-9 days. Can you imagine that? Touching a population almost 16-17 crores in the matter of like almost 12-13 days. Massive exercise. And WHO on their global handle gave a praise to Yogi government, not a WHO South Asia. WHO global handle gave a detailed that how other countries, other large geographies, because a lot of global geographies are of same nature, right? How can they imitate this door to door? And this door to door also did one thing, Shriji, that also created a confidence, right? Because finally someone is going to their house, talking to them. Are you COVID positive? Okay, they don't even know what is COVID positive. Like, are you getting fever? Are you getting cough? What are the basic symptoms? What are the SOP a doctor will ask, right? And also giving them, okay, nothing will happen, just use mask. Because there is also a panic that is being created, like some required, some unnecessary, right? So that also created a huge, like, kind of a relief, mental relief. Yeah, there is someone who is coming to me, and this exercise will repeat, it seems, again within next fortnight, right? So these two, management of oxygen and this massive rural drive, right? That's why the cases are not come, like, automatically will not come down, right? That's why the caseload of 300,000 will just come to 1.3 lakh, and the daily cases of 36,000 is today's 8,000, right? So these are the two massive things, Shriji: oxygen supply availability, and the massive rural drive.
Thank you, sir.
Thank you so much, Shantanuji. Yeah, so my question to you, sir, is, BJP or Yogi Adityanath ji held Panchayat level elections in Uttar Pradesh through this phase of COVID. And as a byproduct, of course, BJP did not perform very well. This is something that had to be done, in my opinion, because it's another timely feature. If the nation is going to state level elections, why not conduct the Panchayat level elections? So what was the rationale behind conducting these elections, and how can it be blamed on Yogi ji? I don't know how you can blame Yogi ji, but perhaps you can explain the rationale behind it.
Right. First of all, all the two statements are not true, right? And that's how the information is available. So you are not wrong, but that's the way information is available. You rightly said, election commission central. There's a central election commission which conducts the central election, the state election, and there is state election commission which conducts the municipal elections, right? And the panchayat election. Yogi government on record went to the court to ask for the delay of the panchayat election. I'm repeating it. Yogi government on record went to the court. Can we please delay this election? We are in the middle of a crisis. Court categorically forced them. Allahabad High Court, UP Allahabad High Court categorically forced them. Nothing doing. You have to conduct this election. These are very important elections. They will set up the pradhans of 97,000 villages and panchayat committees and block committees. And before 30th of April, I need results, right? And that's why UP government was forced to do it. That's point number one. Second, that, okay, BJP did not fare well. I think to your viewers, let me explain, this is a very different kind of election. These are the elections which are not run on party symbols. Can you imagine now? So you don't even know who won, who lost. So they are only BJP supported candidates and Samajwadi Party supported candidates and BSP supported candidates, right? Let's say, I'll give you an example. Even Aam Aadmi Party is claiming that we won 200 seats. And you can't verify that claims, but these are only supported candidates. There was no party symbol given to them. So you can't even calculate meticulously that who was who. You can just make a fair guesstimate. Yeah, these guys used the poster of Yogi Adityanath, so he was a BJP candidate, right? And a lot of rebels also use your poster. You can't stop somebody for using your poster, right? Because anyway, you're not shoot a symbol to him, right? I'm sure people will understand what is the meaning of symbol, right? The party has a symbol which is given only to national parties. So that's point number one. Point number two, if the people who understand India's politics, so let's say someone like Sharad Pawar of Maharashtra, his politics is the politics of cooperatives, right? He has a huge hold of cooperatives, milk cooperatives, vegetable cooperatives, onion cooperatives, all of them, right? Mulayam Singh Yadav's politics is the politics of Zilla Panchayat elections. Whoever government is, even previous BJP governments or Mayawati government, his own government, he was always strong on Panchayat elections. So last Panchayat election, which happened 2015, so there are 3,000 seats, 3,050 seats. UP has 80 Lok Sabha seats, 400 Vidhan Sabha seats, assembly seats, and 3,500. So you can imagine how hyper-local must be the election. There are examples where two brothers from the same house, one is a BJP-supported candidate and one is a SP-supported candidate. So the issues are not party-based issues. It's not a vote on Yogi or Modi. It's the vote on that boy, right? Whose brother is fighting from another. So it's a very hyper-local election, number one. It's not in party symbol, number two. And Samajwadi Party, or Mulayam Singh Yadav in particular, that's his politics. Like everyone has their forte, right? So in last 2015 election, they won 1,500 seats out of these 3,000 seats. This time they only won, as per the claim, only 900 seats. And BJP first time in life fought this election with full fight and vigor. And last time, so out of this Panchayat election, 75 districts will get 75 chairmen. That process is stalled because of Corona now. At least thanks to the court, they agreed to it, Yogi's demand, right? At least don't force me for the getting the chairman elected, right? Last time out of 75, 62 chairmen were of Samajwadi Party. And to my assessment, this time they will not be able to make even 35 chairmen. So Samajwadi Party, in fact, gone down on their stronghold of Panchayat elections, right? Even, yeah, and one more thing, 2015 they won big time, 2017 they lost the election, the assembly election. So it's not even like a reader to any assembly election or Lok Sabha election. It's a very separate ball game, right? So yeah, so UP government was forced by Allahabad government, and BJP in fact improved far more from the previous performance, and Samajwadi Party went down from the previous performance. Yeah, so that's the take on the Panchayat elections. Hopefully, I was able to convey it.
Thank you so much, Shantanu ji. Sridhar ji, your turn, sir.
Thank you. Shantanu, I want to bring it back, into a different context. So now you need a medical healthcare ecosystem to deal with a crisis of COVID, right? Liquid oxygen is one of the components that is essential from an augmentation and auxiliary support. But then you have, vaccination is one, testing is another, availability of medicines and antibodies that you refer to, remdesivir, then post-COVID treatment facilities, emergencies, therefore beds to deal with emergency situation. So one of the questions that often gets asked is how well UP is organized, given the legacy of the healthcare as an infrastructure in India, is going to deal with today and what is to come tomorrow at the urban, at the district, and at the rural level?
Yeah, I think that's a very perfect question. See, I think very pertinently, the officers in UP, with the guidance of Yogi Adityanath, is already talking about the third wave, right? Because second wave was not talked about in India in this much vigor, because till it came, right? So they're already talking in public also that what exactly we are going to do for the third wave. Like we did not have much clue for second wave also, like, or anyone in the world, that what kind of mutation, as Sree told, what kind of symptoms, because now the symptoms are very different from the wave one symptom, right? And now the prediction is that the wave number 2, wave number 3 will be harming the children also. And there is also one logic to it, because adult population is getting vaccinated, because vaccination is all open in India from 45 plus earlier and now 18 plus also, right?
Yeah.
So what Yogi Adityanath is doing, first of all, he's making sure there is a pediatric ICU in all the 75 districts, making sure there's a 20 to 100 bed pediatric district based on the size of the district. That's one. He's making sure that the PSA plant, the PSA plants are which can generate oxygen on their own, right? So not this ferrying business. So there's a ferrying business stop. This ferrying business is quite a logistical nightmare, right? From getting oxygen from here and there, right? So now this 300 PSA plants are already like getting installed. As we are speaking, they're getting installed. So, and the timeline is hardly 50 days for them. So next 50 days, so till the time this ferrying is happening, all the medical colleges, all the 75 district hospitals, all the bigger CHCs, community health centers, which are in the blocks, will get a PSA centers also. And with now they're doing a meticulous study of the cases, that how much medicine stock should be there in each of this district, right? So I think now we have a confidence that they are already going like 5 times, 10 times of whatever the prediction is there, which was not done the last time. On the vaccination side, UP has already vaccinated 1.5 crore people, which and 18 plus also started from 1st of June, the registration. 5 lakh in only 18 plus. And all of a sudden, last 2-3 days, the vaccination drive has got a huge pump. 1,100,000 people, 18 plus, got vaccinated just today, right? That's today's data. And I'm sure you know this, a lot of people created huge vaccine hesitancy, particularly in Uttar Pradesh. And for some reason, people are not even pulling them out, right? Akhilesh Yadav on record said, if I can say that in Hindi, ये तो बीजेपी की वैक्सीन है, मैं नहीं लगवाऊंगा. This is BJP's vaccine. I'll not administer it. I'll not even take this vaccine. And till now, maybe he has taken it. His family people has posted. Shivpal Yadav, his uncle, was a very famous politician. He has sent his picture, right? But he might have taken it. I'm sure he must. The COVID is so dreaded. He must have taken it. His father, Mulayam Singh Yadav, is so old and he's quite sick. He must have taken it, but he has not put his picture. right? Though he lost the election, but a lot of people voted for him also. In fact, one of his MLC, one of his elected representative, Ashutosh Sinha, he went ahead and said, no one should take this vaccine. No Samajwadi should take in vaccine. No one in UP should take in vaccine. He added that this vaccine can cause impotency. Some other scientific discovery he made, right? And these are like, we may laugh at it, but people do listen to them. And this is on a press conference. Like they're telling in public, like with full banner and all, right? So a lot of people telecast it. And that's why even in the first phase, when the health workers and frontline workers are getting vaccinated, there was a huge vaccine hesitancy. Similar done by Congress, Rahul Gandhi, they're saying co-vaccine is this. Till the time Dr. Fauci of America said, no, this is a very effective one. A lot of people in India not ready to believe the scientific evidence produced by ICMR, right? So I think opposition has done huge disservice to creating this vaccine hesitancy. They can do politics. I'm sure every country opposition will do politics, but not at this level, right? And I'm sure all of them, they've taken their individual vaccines at their homes somehow, right? But they're creating this huge vaccine hesitancy. So and now UP has also set a very good trend. They are the first one to send a global tender, right? To all the vaccines which are approved in India, and the tender will be closing on 21st May, right? And fortunately, Government of India 3 days back also presented a very detailed plan in which month how many vaccines will be available, and by that plan, by December we will be able to double dose almost 100 crore people, right? Which is almost 85% of our whole population, right? So yeah, that's I think the future is looking at how we're looking at future. Yeah.
Thank you, Shantanu ji. And see, one thing that considerable portion of the media in India and abroad likes to do is to paint India in a negative light. I mean, they will go to great distances and sometimes even create fake narrative just to justify that, oh, things are really bad. Now, one such thing was the floating of dead bodies, so-called floating of dead bodies down the Ganges River. Can you kind of throw a little bit of light, because you are a person on the ground, you probably have better handle on what really happened and what is the real truth behind it?
Yeah. I think Western media and some of their followers in India have really stooped down, right? I'm sure they don't do this kind of journalism in their own countries. They don't show dead bodies. They don't show crying people. They don't enter into hospitals, wards, and just create panic inside. Like a lot of white reporters entered in UP hospitals and just creating panic. Even they don't understand English. They're having translators. They're creating problems, right? I think they have shed all limits of journalism, first of all. So, and they have shown also the pictures of burning bodies in Shamshan Ghats, right? And it seems they're selling also in Getty Images. They're selling those images also. I'm saying to that level, right? So those floating images in Ganga is real. There are dead bodies that are floating in Ganga, right? But let me tell you what is happening there, right? First of all, these Shamshan Ghats are not government Shamshan Ghats, right? The place where you burn bodies are not government places. They're all trusts, they're all individuals. Very few places, they're government bodies. There are 2-3 reasons that's happening. I inquired personally, in fact, before your session to Prayagraj, to Banaras, where there are large bodies are found. There are 2-3 reasons, because number of bodies are for sure more. If 100 bodies are burnt on a normal day, 400 bodies are coming today. That's known, and that's even counted also, right? So half-burnt bodies are from the people who are managing Shamshan Ghats. Half-burnt body, they're flowing. Earlier, they're only flowing the ashes, the half-burnt bodies. But now the government is taking charge. When they got to know that this practice is happening, they're taking charge and they're making sure this is not happening. There is also one tradition in a lot of places that they flow the body as a tradition. There's a major tradition in Banaras and that east coast, right? They tie the body with heavy stones and they flow the body. That tradition, even if you search 2015, 2016, 2017, when there's no COVID, you will find 100 bodies found in Banaras, 200 bodies found floating in Banaras. So I'm not saying that's a welcome practice. Governments try to check that. But again, see, Ganga is a huge coastline. You can't put like a policeman everywhere, right? So yeah, so these are the 2 things. So bodies are extra, and the private Shamshan Ghats, half-burnt bodies are being flown, and now government, when they realize that this is happening, they're making sure that that should not happen. And some things happen by happen naturally every year, right? But people trying to show as if people are just dying like flies and just thrown away, right? That's like far, far away from the truth.
Thank you very much, Shantanu ji. Sridhar ji, we are about 35 minutes into this program. Perhaps one question for you and one question for me, and then Shantanu ji can summarize it for us. Please go ahead,
Great.
sir. Yeah.
Thank you. Thanks, Shantanu for all the responses so far. Now, I think it's today, India time earlier, this Allahabad High Court made a statement, which is the government to come up with adequate infrastructure, especially in Tier B and Tier C cities, as they call it, because they have indicated that there seems to be not enough ambulances and so on. Given the detailed presentation that you have laid out, this Allahabad High Court seems to have always some. Is it a political connotation or is it the on-ground reality that they are trying to ask the government to address?
See, this judicial overreach is on full blown in last 3 weeks, anyways, at every level, at central government level, at high court level, right? They have made statements like Madras High Court has statement that all these deaths are charged to Election Commission because of those 5 state election,
Sure.
right? One of the courts went ahead to say that I think we have to take over the government, right? Allahabad High Court forced UP to put a lockdown 20 days back with UP with Yogi Adityanath refused that let me please run my administration. You don't know where to put the lockdown, where not, and in fact they're using a very interesting ideology which is saying Jivan bhi Jivika bhi, meaning the life should also go on, and Jivika means the jobs should also go on. You can't just last time we locked down because we didn't know the virus. We didn't know anything. We didn't know what will happen, right? We were just all surprised with the virus. We just locked down. Well, let's regroup, right? But now we know that with a COVID appropriate behavior, you can run a lot of factories. In the whole factory, you need just 5 people, which are quite distant from each other. You need not lock down that factory, right? Because you need a lot of production, a lot of income to happen. Because government can't keep supplying money to everyone, right? Just sitting at home. A lot of productivity should happen, right? So I think courts literally they don't have any understanding of public health, right? So there a lot of PIL, so there's a lot of politicking is happening. So a lot of people, a lot of these NGOs, a lot of these motivated NGOs whose FCRs are stopped, whose money flow is stopped by Narendra Modi or Yogi governments, they are just going to court presenting some PIL, and because PIL is, they are admitting every single PIL, which normally they don't admit, and they're giving some judicial verdict, some extra judicial verdict. In fact, central government also, I think some days back, the Supreme Court or one of the High Court, Delhi said, you should vaccinate everyone in X days. You should make sure the vaccination should be available at doorstep. See, I'm saying Sree ji just presented how Asian countries are facing. It's not noodles, right? That I'll buy the noodles and vaccinate everyone, right? So out of the blue, without any scientific acumen, without any data, just as a passing verdict, sitting on a big chair, okay, you do this, you do this. I'm saying, I know they're judges, they're fine, but again, they're just taking a high moral ground, which is very far away from how administration runs. So I'm saying, but again, it unnecessarily adds to the panic. It just gives 2-3 dialogues to the opposition parties and they keep running. Oh, now the High Court is also telling. As if High Court is like some huge WHO and they understand public health. And at this point, I just want to mention in India, in all the courts together, 4.5 crore cases are pending. Even Supreme Court itself, 60,000 cases are pending. And they're saying we want to take over government. Maybe then government will take over the Supreme Court. What is this taking over thing that's happening? So I think I think all the courts, I think they should refrain and they should trust the governments voted to power by the people. See, this is almost like a tsunami. Countries with as robust health infrastructures like United States of America, UK, Italy, Spain, we have seen what happened to them in last wave, right? This is happening in India now with India's infrastructure. And again, even if you discount for all the undercounting that's happening, right? Our per million death rate is still like not in top 80 also, right? And all these, your BBCs and Washington Post and CNNs of the world are just giving absolute numbers. India has these many cases. Come on, India will have these many cases. If you take the denominator of what kind of population we have, they're saying India's, one reading I've seen, India surpasses Italy's cases. I mean, Italy is a tiny country. Like UP, you know, right? UP's population, only 5 countries can match that population in the world, including India,
Yeah.
right? So you're talking about Uttar Pradesh, India as a massive country, and just I think huge irresponsible journalism happening. I'm sure it must be good for their own ideology, their own TRPs, their own viewerships. But again, I'm sure they will regret it what they're doing at some point.
Thank
Th-
you.
Thank you, Shantanu. I have one observation, perhaps a question. Shantanu, I travel quite a lot whenever I'm in India, and especially in the south, I travel far and wide, even going through rural areas. One of the things I never miss is the amount of migrant labor that comes to work in the southern parts from UP and Bihar. And so, what has happened for the migrant labor is they've had to leave wherever they were, whether it was Mumbai or Delhi, twice now.
Right.
Once during the first wave, and now again. Now, when they go back to their native places, whether it is a village or a district or a town, are they still following the same quarantine habit so that they don't infect the people around them that they are meeting? How is that being enforced or how being monitored?
So I just mentioned that quickly in the how what was the one of the good point which was mentioned in the first wave. I'll repeat it again and elaborate. So in the second wave, the exodus is not that big because multiple states have not put that kind of lockdown this time, right? So all the factories, all the house helps, all of them are not closed. So I think this exodus is not even uh, 30% of what happened. That time is almost like everyone came back because that time it was panic. Governments did not know. Some governments, at least Maharashtra and Delhi, behaved very responsibly. They almost pushed people out so that they have to deal with less number of people, right? All of that happened, right? And as I told you, Yogi Adityanath, make sure the people who are coming from far, they can use the train facilities which Government of India ran, and the people who are in nearby state, they make sure they send buses in large quantities, like 1,000 buses, 800 buses. And in one of the cases, you will not you will be surprised. Yogi stood at the bus stop himself. Can you imagine? Yogi stood at the bus stop and in a place called Noida, right? And why I'm saying Noida? Akhilesh and Mayawati don't come to Noida. You know why? It seems there is some bad omen if you come to Noida, you don't get re-elected, right? They never came to Noida in their life, in their whole career, right? Hopefully Yogi get elected, or this omen will continue next time. That if some and Yogi has traveled to Noida multiple times, and he stood in the bus stop of Noida and Ghaziabad to make sure these buses are going smooth, right? So, and when they travel back, the two things are happening to them. One is the quarantine thing, and I'm sure you're also curious what happens to their jobs, like how they earn now, right? So, two things which are happening. First, or three things I should say. First is as they enter, they're testing antigen or basic testing, temperature testing is happening, and they've made quarantine centers within outside the boundary of the village. So normally schools are a little away from the village. Not away means like half a kilometer away. So they made sure in a school, Panchayat Bhavan, or they make to a temporary structure. There are a facility of quarantine structures. All this 97,000 village, right? That's point number one. Right? And then only they enter, right? They have made something called a vigilance committee. They're called Gram Nigrani Samiti, where they were given goals that they should make sure that no one who has a symptom is just roaming around, right? Because government cannot, they're not so much police, right, which can go in every village. So they have made sure that the local committees. And the one data point which will also make everyone very comfortable, when this massive drive happened 2 weeks back, they're going to every village, right? There's 70% of the village where there is no one who's infected, right? Can you imagine? That's a big data. In 100,000 villages, there's 70,000 villages where there is not even a single case, right? Only 30% of cases have, some has 10 cases, some have 5 cases, some have multiple cases. But 70% villages have no cases at all. And there, this Gram Nigrani Samitis, the village surveillance committees, are very effective, right? So that's, and now, second thing, what they will do now. So if they are farmers from the PM Kisan, 2,000 rupees are getting in their account. If they are enrolled in the ration scheme, Yogi government has done a beautiful thing in last 4 years. They have made sure that every ration holder, which is almost 20 crore, is Aadhaar seeded, right? Earlier it was like all haphazard, based on the mercy of the ration shop holder if you get the ration or not. So now every single transaction Yogi can sitting in Lucknow, that who got how much rice, how much wheat, what time, what time stamp, right? That already happened, and they are reaping the benefit now. So the ration X, the quantity of the ration is also doubled. So X amount of ration is given to them. And also the Manrega scheme is still on. And Narendra Modi had made a beautiful amendment to Manrega scheme. That Manrega thing is not only to digging up holes, they can also be streamlined in any infrastructure project the government is making, right? So a lot of the expressway project where there is not a lot of people have to gather together, they're making sure that all this labor is returned wherever they can be pushed, right? So all these four steps are being taken. So on the migrant count only, UP got a lot of appreciation in wave one, that how they beautifully manage migrant, bringing them, quarantining them, giving them ration or making them any scheme which is pending to them, and making sure a large quantity of them can be pushed into whatever labor requirement is there in the state. So yeah, all of these 4-5 steps.
That was a fascinating look at the success story that is the that is the UP. Always when I say the United is what comes to my mind. I beg your pardon. Uttar Pradesh model has been an astounding story here. Sridharji, if you would like to, collect your thoughts on what you heard today, and then we can call it a wrap. I'm very, very happy and grateful to you, Shantanuji, for taking the time out. In fact, I reached out to you less than 48 hours ago. You're very gracious to set aside this time to come on our line online and share your thoughts on PGurus channel. Sridharji, your closing thoughts are, and then we'll call it a wrap.
Great. Thank you so much, Shantanuji, for your detailed, elaborative responses to some of the questions that we had asked you. I think the key takeaways, we always use the phrase which is 2 + 2 - right? So the plus part, the two pluses are that there is a clear articulation of the comprehension of the issues that that Uttar Pradesh, we also get united. So Uttar Pradesh has dealt with in terms of with 233 million people, or 23. I think my numbers are correct. 23.3 crores. Yeah, 23.3 crores. With a 1.63 million or 1.63 crore cases. It's quite a remarkable in terms of how the management has occurred and the infrastructure that is being put in place that to address the issue. So these are my two pluses. In terms of the first feedback that I would give is there is a complete lack of communication, and this communication is what makes it. Well, the fact is, Harvard and Guardian had to present UP's case is a reflection of the communication. So therefore, I think something has to be done. If we have to give a message, daily, why not you communicate to say what is happening, what is being done, what are the problem points in various districts that is propping up, how much of vaccinations has been done, and how much of vaccines to go. So at least, it begins to address on that point, which is namely how the dispensation on the communication. The second is very much the healthcare. It's called as a disruptive transformative innovation. Whenever you have a crisis, then you have a disruption. So then you begin to put a transformative framework, because by normal course of activity, you will not build cryogenic storage. By normal course of activity, you will not build an industrial logistic which connects your railway infrastructure, which has existed well beyond for more than 100 years. You would not connect. So the question, therefore, is what is it that is being done where UP is building the infrastructure? Again, this relates to communication, but this is more around the care that will happen as part of this. I think if those are my kind of closing comments on 2 + and 2 - if I have to walk away from this session. But thank you so much.
I think I'll surely communicate to whoever I'm in touch with. But again, a small point. So daily, the Health Secretary of Uttar Pradesh and the Information Secretary of Uttar Pradesh, they daily do a Hindi briefing on their Uttar Pradesh channel. And exactly number of cases, number of caseload, number of vaccinations, which district, what is happening. But that's done in Hindi on their channel. And a lot of the government information officers do tweet also in Hindi and English, whatever. But I got your point. But the whole comprehensive strategy, how it's being done. Currently, I think they're managing other things beautifully, and the people know it, right? People of Uttar Pradesh know it because it's happening with them, right? But again, bigger, because a huge propaganda is also happening. And I'm sure you all know that next year, February, which is not even like 8-9 months away, there's UP elections. So you can imagine, and UP election, because of such massive population, holds a huge significance, right? So opposition, when Akhilesh Yadav said, "मैं BJP का टीका नहीं लगवाऊंगा, this is a BJP's vaccine," and he's making sure the photos of this floating dead bodies or the photos of the burning, he just, everyone in the opposition just playing a very negative politics, because for them it's the good hope, because in the first wave Yogi and Modi both came as a huge winner, which was like quite a problem for a lot of opposition parties, that how can you come out a winner with such a dreaded thing, right? You also have a vaccine, like one indigenous, one India made, right? Now there is one more vaccine, Indian vaccine, Zydus, may get approval in July. You are getting vaccines from Russia. You are also talking to Pfizer and Johnson & Johnson. So how is everything is getting like so smoothly, right? So that's why a lot of people who are looking their politics in this, they are making sure they're just throwing muck, right? Daily muck they're throwing in the belief that some muck will stick, right? And that's also creating a lot of confusion, a lot of panic, a lot of anxiety in people, right? And that can only be dealt with a counter very clear communication, as you communicated. Yeah. So I got your point. Yeah.
Thank you, Ji, and thank you, Shantanu.
Thank you very much, Shantanu ji, and we'll be back again with more such interesting hangouts. And Shantanu ji, we will again perhaps we will meet again for another hangout, maybe 4 to 6 weeks time, when you feel like there's a sufficient data for you to share with our viewers. Certainly, it has been an absorbing session, and once again, thank you and namaskar.
Thank you, Sree.